Hi, my name is Mary Coe, and I'm a physical therapist here at Physical Therapy and Sports Rehab in Norwood, Massachusetts. September 22nd is Fall Prevention Day, so I thought it would be a great opportunity to go over some safety tips to prevent falls in the home, since falls are the #1 cause of injury and hospitalization in older adults. First off, when you go to see your doctor, always bring your medication list with you. Certain medications, such as sedatives or antidepressants, blood pressure medications, can cause you to feel dizzy or imbalanced. Especially when you're on blood pressure medications, just make sure that when you first get up from sitting for a period of time or when you get up in the morning, that you stand there for a minute or two to let your blood pressure kind of stabilize. That way your first few steps will feel a lot more steady. Look at your footwear. Make sure that your shoes fit properly, that they have non-skid soles, and you want shoes that are supportive, that have a good arch support in them. A sneaker is a good example of this. Never walk around in socks around your home or loose slippers or flip-flops. Also look around your house for things that could be trip and fall hazards. Loose cords, loose items, or things that kind of stick out and impede hallways or doorways. Make sure that you remove those. If you have rugs that aren't secure, make sure you do secure them with tacks or double-sided tape. If you have just small loose area rugs around, remove those altogether. Make sure anytime food is spilled or liquid is spilled that it's cleaned up right away. And if you have stairs that are wood, make sure that you get some type of non-skid tread to put on those stairs. Also at home, you can make use of adaptive equipment to keep you safer. Using a bath mat or non-skid decals in the tub or shower, using handles in the tub or shower, and the kind that you actually screw into the wall versus the suction cup kind. Look at your stairs. Stairs should have an available railing on both sides. Also, proper lighting at home is important. Make sure that you make use of night lights at night in bathrooms, in bedrooms, and in hallways. Finally, you may need some type of assistive device to keep you a little more steady, such as a cane or a walker. Also, keep moving. It's important to exercise. And to get you started with a few basics, I'm going to show you 3 different exercises. So one would be standing at your kitchen counter, and you're just going to rock up onto your toes and then rock back onto your heels. And you're just going back and forth about 20 times. This helps strengthen those balance reactions, which are important for you. Also, while you're standing at the counter, you pick up one leg and try balancing on the other. Also, when you're doing this, pull that belly button in nice and tight to bring in those core muscles. And then you would switch legs. And you want to hold for about 30 seconds. If that exercise gets too easy, you can try swinging the other leg forward and backward about 10 times, or swinging side to side about 10 times. That makes the activity a little more dynamic. Finally, you can take a kitchen chair and work on squatting down to the chair and standing back up. Pull in your belly button again when you stand up to bring that core in. So these are getting your glutes, your thighs, and your core, which are all important in stabilizing you for balance. If you still feel like your balance is not quite where you want it to be, call your physical therapist. A physical therapist will take you through a specific evaluation to find out where your individual deficits are, and then they will come up with an exercise program to work on your specific deficits to get you feeling balanced again.